Good afternoon, everybody, and welcome to today's webinar, How to Win Under Home Health Value-Based Purchasing. I'm Scott Regan. I'm your moderator for today's webinar. And before we introduce our speaker today, I would like to do a little bit of housekeeping. In the top left hand of your corner, you'll see that we now have a Q&A box that has replaced the countdown timer. And if you'd like to ask a question of Karen as we go through the presentation, or even make a comment, go ahead and put it up there. Now, that is an open forum, so whatever you logged in with, that will be your identifier. So I know there's a person here named Margie Green. So Margie, if you type in there, they'll say Margie Green on there. So that's how you'll be identified on there. But some of you may know each other. Who knows? At the conclusion of today's webinar, you will also receive an email that has a link to this slide deck. So if you can't write down all the notes that Karen's going to share with you of all these nice little tidbits, know that you'll get the slide deck and you'll be able to refer back to it. We are recording today's webinar, so we'll also send you a link to that so you can replay it at your convenience. You can replay it for your team, your staff. You can go back and refer to it whenever you want. So let's do a quick sound check. I want to make sure that you're all hearing me okay, and so we want to make sure the audio is working fine. If you'd raise your hand, and you can do that by clicking the silhouette of the person with their hand raised at the top of your screen, and there's a little down caret. And if you click on that, you can raise your hand. You can also give me some nice applause or give me a smiley face, whatever you want. I see some hands going up. Thank you, Ann. Thank you, Katrina. I'd like to hear from a few others. There we go. Christine gave me a nice little check mark. Oh, some applause from Alex. Thank you, Alex. Ann changed her hand to applause. I love technology. All right, good deal. It looks like the audio is working well. We still have people coming into the room, a little stragglers. If you do have some problems with your audio, usually it's at your end, not at our end. It's usually because you have a bad internet connection or a wobbly internet connection. So if things start breaking up, your alternative method to listen to the webinar is dial the number at the lower left of your screen, 404-400-1021, and punch in that conference ID, and you can actually listen to it on your telephone, and it'll be very crisp and clear. And if you're not getting good audio on your computer, that's a good way to do it. All right, so with that, let's jump into the webinar because we have a lot to discuss here today. So let me introduce our speaker, who is Karen Thomas, the president of Advanced TeleHealth Solutions. Karen is a nationally renowned speaker, and she uses her expertise in telehealth monitoring to educate hospitals, home health agencies, and other companies and organizations about the benefits of telehealth solutions. She's been running this company. She started this company over 10 years ago. She's worked with numerous organizations, including home health agencies, on how to actually improve performance, outcomes, reduce costs using remote patient monitoring. So with that, Karen, welcome to the webinar.
Well, thank you, Scott, and good afternoon to everyone. And I'm very excited about our webinar today. So with that, should we go ahead and get started?
Let's dive right in.
Okay. All right. Well, I think everyone knows what we want to discuss today, but value-based purchasing should come as no surprise to us. We've seen it with the hospitals. We've seen it now going into the physician reimbursement area. So I think everyone on this webinar has probably anticipated value-based purchasing. And if we think about it, it could be a great opportunity for post-acute care, but depending on where each agency might be, it could also be one of those disturbing technologies or reimbursement changes. In home health have experienced reimbursement changes for many years, but primarily they have been payment reductions rather than payment methodology. So today we want to talk about how remote patient monitoring or telehealth can help us maneuver these waters. So with that, I think it's really important to quantity versus quantity. The real key there is to
Nope. I got ahead of you. Sorry.
You're going to get ahead of me a little bit? Okay. Well, you were rotating, weren't you, Scott? Okay. Well, let's just talk a little bit about quality versus quantity. I think that it's really important that all the agencies out there and everyone working with agencies understand that we now have to be able to prove our outcomes. And what we're going to talk about today is that methodology of how we can provide a different means of care delivery and care coordination to generate outcomes. With that, we'll also talk about data and how important it is. And data has always been important. However, I think now there's an increased emphasis on what we do with that data. The other thing is understanding our population. What do we need to do to get where we can appropriately be reimbursed and be incentivized through value-based purchasing? So that's where we're going to concentrate today, and how telehealth or remote patient monitoring can help us. So if we think of the impact on home health providers, it's very important. It's actually disruptive. What we're going to really look at is possibly providing patients different needs. And then we're also going to think about, can we really care for all the patients that we've cared for in the past in the same manner? Our delivery model will change. And we'll talk a little bit about, as we talk about a successful program, we're also going to talk about our corrective action and how it needs to be timely. We'll talk about the analytics. How important are the analytics? And you'll see that as we go through setting up a program. Because we want to remember that as we put together a remote patient monitoring program, it's going to give us the data. But with that data, we're going to be able to take that data, maybe look at some predictive modeling, and really determine how we can make an impact. Because at the end of the day, it's not about making visits, it's about getting the outcomes that we need. I think the other impact on home health providers is that our referrals may actually be impacted already. We're talking about hospitals being reimbursed on value-based purchasing and physicians. So as we provide care to those patients, if we think about that continuum, it's going to be key if we can prove and show that we're providing care that fits into that continuum and helps everyone meet their goals in that value-based purchasing model. So we're going to talk about how home health providers are really key in that continuum. The pilot study, I think that's a heads up to everyone. We know that there are 9 states who are already working with value-based purchasing, and this wasn't an option, so it really was mandatory for those states. That's an indication of what's to come. Obviously, we know this will be in our future because the other providers are doing the same, are being paid in the same methodology. So now let's talk about the impact of telehealth. We're going to talk about how it is the tool. It's going to be that tool that will cost-effectively touch people through technology. We're going to be gathering vital signs and biometrics and symptomatic data. It will give us the ability to know what's going on with that patient and to react timely. Actionable data, giving us that knowledge, and we're going to talk about how to cost-effectively do something with that data. This enables us to do well, not only with value-based purchasing, but if we think about the triple aim. The patient will have a good experience, excellent care, and we'll do it very cost-effectively. So that's where we need to go today. And Scott, with that, let's take a poll and see where our audience is with their program. Scott has put together a great poll for us, and what I'd like to do is anyone can check anything, check where you are on this program, where you're in putting together a remote patient monitoring program, or that you've recently launched one, for example, and need to refine it, or maybe you've had a program that you have worked with in the past, but it's not really generating what you want that program to do. So maybe you're just doing telemonitoring, but not generating your outcome scores. So I'll give you just a moment to flip through here and answer where you think that you need to be within your schedule, or where you are now on your schedule in launching a remote patient monitoring program.
And Karen, while they're checking off the answers, just a question for you. A recent study came out in the last 6 months. It was a survey of healthcare executives, and over 80% of healthcare executives who responded to the survey said that one of the biggest transformations in the next 5 years, 5 to 6 years in healthcare is going to be the implementation of telehealth. And does that surprise you that so many healthcare executives are really now focusing on telehealth?
No, actually it doesn't. And I think the reason they are focusing on telehealth right now is that they know they have to work with a different method of delivering care. And right now, if you think about it, the reimbursement is going down. There are more people where not every state has Medicaid reimbursement or expanded Medicaid. And in addition to that, there's bundled payment methodologies for reimbursement. So they're looking at having to go at risk. So they're looking for other answers to make sure that they get the best care in the most cost-effective manner. So Scott, can you tell where we are on our polls here?
Yeah, sure. It looks like, not surprisingly, the majority of the folks who are attending the webinar today are at the front end, the early stages of remote patient monitoring. A few folks are saying we're just exploring this idea. Well, you're going to learn a lot in the next 45 minutes or so. A few others were actively discussing a remote patient monitoring initiative. A couple folks said it's a strategic imperative for us, and we are committed to launching this year. And then we also have a couple on the webinar today who have been doing remote patient monitoring for more than a year. So it'd be interesting for those folks who are heavily into remote patient monitoring already as we go through the presentation. Love to have some comments from you as to some of your learnings that you may be able to share with the other people in the webinar. So don't hesitate to add some commentary to the things that Karen is saying, or just throw up some ideas and some solution ideas that may be of benefit to the other webinar participants. So Karen, we're going to dive back into the presentation.
Okay, great. All right, well, we'll just go on to. Okay, so I think let's talk about, I know we have a lot of things to get through today, but let's talk about what really will assist you in having a successful telehealth program. And I think that it's key that we're working with, we start out with goal development. Oftentimes we see companies that want to start a telehealth program and they decide that's the goal. But really, if you think about it, you really need to establish what it is you want to do. Do you want to reduce ER visits and rehospitalization? Are you having an issue with a nursing shortage? Do you want to reduce your cost? The key is to define what you want to achieve or what is the weakness that you want to address. That strategy should fit in with your home health strategy in total. The next thing to do is really take a look at what's your knowledge assessment. What do you already understand about a telehealth program? You need to be aware of what equipment and software options are out there. Are they HIPAA compliant, FDA approved? The key is you want to be able to match that equipment with what you have decided your goal is. And we often see that those two are not always in sync. Also, what is your prior experience? Do you have the resources within your agency to develop new programs? And in this particular case, what is the operational expertise? You're going to be looking at a call center, which is a different approach to providing care than possibly what you've been accustomed to in the past. The other thing that I think is extremely important is the clinical aspect. Do you have the clinical team in your area? Do you have a nursing shortage, or is there an abundant staff where you're able to pull in that clinical team and understand what type of training and licensure they need? And timeline requirements. The pilot states, obviously, they're already working on their baseline and understanding where they are, and they will be judged either on maintaining their outcomes or improving them. But what is the learning curve? What is it you want to accomplish, and how quickly you can get there? So always remember, what is your sensitivity? If it's a competitor that's already doing this, then how quickly do you need to implement your program? And then the other thing is really understand how you want to handle your operational structure. And what we're going to do in the rest of the webinar is really talk about the in-house development and what it takes to develop a successful program. Now, obviously, there is outsourcing, and we do that for a number of people, but there are a number of reasons that you may want to consider that, whether or not you're in a startup or you want to refine or refresh your program. Things to think about there are that it's quicker to market. You do not have to deal with the staffing issues. The learning curve has been experienced by someone else, for example, and that there's great economies of scale. Okay, so here, what we want to do is talk about that roadmap. So we're going to talk about the implementation and what we need to have to move even further down the line once you've got this program, you've got your goals in place. And that's how do you identify your team? One of the most important things that I can say there is that even though it might seem rather basic, I've seen this a number of times where the management team is put together for this program, but those people with the responsibility don't always have the authority. And as we talk about later on the integration, that's going to be key. To have a successful program, the people responsible must have the authority. They must be committed in that this is not just a side project for them, because they will need to understand the call center efficiencies and what those goals are. It will take a lot of communication skills. The other thing in identifying that team is having the right clinical team, and we'll talk about that just a little bit later. And to understand your support staff and deployment, those will be very important. And establishing patient criteria. I would like to give everyone just some food for thought on establishing their patient criteria. Oftentimes we hear someone say, well, we're going to monitor CHF, the CHF population. However, that's very good when you want to define your program and you're looking for one particular group. But when we're talking about value-based purchasing, our whole goal is to move the needle so that we're not penalized under value-based purchasing. So I would like to suggest there, when we're identifying our patients, that we look to see what group of patients are causing our outcomes to go to the unfavorable aspect, the unfavorable scale on rehospitalizations and ER visits and the other measures that we have. So don't get completely stuck on your patient criteria. Just determine what group you need to work on and then decide, do you have the talent to, within that group, to meet the needs of those patients that are causing the most negative outcomes, which may cause you to be penalized going forward. Now, deployment methodology. This is very important when you're thinking about deployment. Oftentimes, it's really not thought of up front, but I would like to suggest that when we talk about ROI, asset management is going to be key. You don't want to lose your equipment. You want to make sure that you're getting it back in and back out again. So explore how you want to deploy your equipment. Will you have someone setting it up? Are you going to have it drop shipped to the home? All of these different methodologies will fit into your plan, but think that through because it will make a big difference on the timing. It's important to get those monitors out there when someone's been in the hospital because they're more likely to be rehospitalized. So think about our timing and our asset management when we think about how we're going to deploy our system. The other thing is establish procedures. While it may sound very basic, oftentimes procedures are developed at a 30,000-foot view, and we don't get the detail within those procedures. And as we go through and talk about integration, it's going to be very important to understand what the procedures are. And what that does is it forces you to understand the workflow right up front. I think some people have often, you hear the comment about preparing contracts early and it takes a lot of time. argument later. Hearing your procedure early on is the front, and you'll understand how to connect the dots on your program. Okay, so now we're going to talk about clinical expertise. Obviously, that's going to be key. We have to look at how will we recruit, and we want to make sure that the clinical team has the training and ability to work with that population or within that patient criteria that we've identified earlier. Think about, they have to have triage skills. They have not met these people. Unless they're using video every time they talk to them with our technology, they have to be able to make a decision and work with these patients and understand how to triage from afar, for example. We also want to make sure that we talk about licensure requirements and that we have each nurse licensed appropriately and in the state that the patient lives. Most of these people will have chronic care issues and numerous comorbidities because those are going to be the ones who are causing the most difficulty in generating the outcomes that we're looking for. They're going to be the most challenging patient. So I would suggest that within that clinical team, that your team is trained in chronic care and that they have motivational coaching. It's really key that we can pull in that patient and have that patient work with us to help them do better themselves. So that will be key. Staffing consistency. The first thing that I think people think about when they think about staffing consistency is that I always have a body in the chair. And obviously, we need to do that. That's extremely important. However, I would like to point out an interesting fact that we found over the years. As you work with these patients, and particularly those with chronic illnesses, those who are in the most need, it's important that you get the patient engagement, that they're working with you. And over time, we have found that not only is obviously to have the staffing levels at the right level, but it's important that you keep the team assigned to the patient as consistent as possible, because with a consistent team, we have found that you will see better outcomes because there is that connection and they're working together. So those are one of our learning points over the years as we have worked with remote patient monitoring. And return on investment. You know, in this day of home health, it's just very, very difficult for agencies to invest money without knowing that they are going to improve their financial situation or at least break even. As the reimbursement has decreased over the years, it's really key, and we're not going to get agencies to participate in remote patient monitoring or any telehealth unless they can work through how they can get a return on investment. And I would like to suggest that we think about return on investment in two different ways. First of all, let's talk about how we would set the program up efficiently. We talked a little bit about asset management, but it's key that we have cost-effective deployment. You want to make sure that you get the right equipment and no more than you need out to the patient in a very timely manner, and that you bring it back in the same timely manner. What that enables you to do is use your equipment more often. So it's essentially what's considered to be an inventory turn. You're in and out, and people are utilizing their equipment as much as possible, and then that's going to assist you with your with your return on investment. The other key is you want to make sure that you're actually managing these assets and that you know where they are, that you have an asset inventory, and that you keep track of them so you're not you're not actually losing equipment out in the home. You may want to do that yourself, or there are companies out there who will actually manage your equipment and deploy the units to the home should that be the deployment method that you would like to choose. The other issue is start with the right equipment. We've talked about how to get the equipment out to the home, but you really want to make sure that you're only sending out the right equipment to do the job you need to do. So that goes back to our knowledge assessment. Make sure that you understand what equipment and software programs are out in the market, and match that up to your patient criteria and your goals. And therefore, you're not sending out more equipment than you need, but you know that you're sending out enough equipment to get all the data and all the symptoms, the biometrics that you need to manage that patient. So if you've got the right equipment, you can keep your costs down, and then once again, manage that asset. The other thing is staffing. It's very important when it comes to a telehealth program and staffing considerations that you know how to manage the call center efficiently. During that time, you'll want to develop a best practice and know which of your nurses, for example, are getting the best outcomes, how long they're on the telephone, what is it that they're saying to the patient. That gives you a baseline to actually manage the whole department, because you want to make sure that they're doing everything they need to do. Within that, it might be training, and we'll talk about what they're actually doing, but you want them to be very efficient so that they are getting the outcomes that you need in the time frame that is accessible. In that case, you may want to research some other resources to see what to expect there. You want to make sure that your clinicians are operating at the top of their license. And by that, I mean that they're not doing what might be considered a clerical job or just going through and checking things off, that they're actually using their skill. And that's where you will want to get the economies of scale. So it's very important because you can have different levels of expertise and skill within your telehealth department. The other thing is, once you are operating very efficiently, the key will be how now do you bring in more revenue? What is the other side of your return on investment? So with some agencies, it's actually looking at new service lines. Do they have other opportunity to provide remote patient monitoring to their patients? For example, some certified home health agencies are now looking at providing private duty services because some of their patients want to keep their telehealth equipment after they're discharged from a Medicare episode, for example. So it may be new lines of service. It may be that you can reduce visits going out to the home by your nurses, and by doing so, as you reduce the visits, it's key, obviously, that you either improve or continue to maintain a high level of quality. But we all know that nurses are at a key premium. They're one of the best assets and best team members that we have, and they're key out there in the field. So we want to make sure that we're sending them out at just the right time. So you may have the opportunity to reduce some nursing visits, actually physically going out to the home, but enabling you to manage more patients with the same amount of team members. So you can look at your visits, look at your overtime. The other thing that is key here would be our incentives for value-based purchasing. If we think about how value-based purchasing is going to increase over the next few years, the percentage that we will either be incentivized or penalized, that on all our Medicare business, that is key to paying for remote patient monitoring, assuming that we do very well in achieving our goals. And we're going to talk about that as we go forward. Okay, our goals. This is really why we're looking at remote patient monitoring in total. I mean, it's all about what are we going to do with it. We have to remember that remote patient monitoring is a service. The equipment is a tool. So we want to make sure that anything we do is going to help us with our value-based purchasing outcomes. And in the guide that we have issued, we've talked a lot about all the different measures that go into this, so I won't go over all of those again, but we know some of the keys are obviously going to be readmissions, ER visits, and hospitalization days. That is going to play a huge impact on whether or not we can actually pay for our remote patient monitoring program. But here again, that's going to go back to our use of the equipment, our success of the program, and identifying those patients that we need to work with who are currently being rehospitalized or going back into the hospital. So now it's important to know where you're starting from. We talked about very specifically understand your population. So you're going to have most likely a group of chronically ill patients with comorbidities. So think through how we're going to fix this particular situation. Telehealth is going to help you focus on those patients because you're going to see, you will have placed the equipment with the right patient. We've talked about that. So you're going to place the equipment with the right patient. You're going to be able to get information on a daily basis. So you're going to have actionable data. And actionable data is what's going to help you reduce, in particular, your readmissions, your ER visits, and actually your hospitalization days. So now, if you think about when we talked about gaining that actionable data, so that's the key. You're going to get the data, but you've got to react to it. And oftentimes we see that's where the ball gets dropped. The information comes into the telehealth center, and there is a response by the telehealth nurses, but it's what happens in many cases after, both in the telehealth department and then in the field. So let's go through that. If we think about actionable data, the key is you now have this data. You need to communicate and respond with the patient in a very timely manner. That could result in education, or it could result in a care coordination with another care provider, or a clinical intervention. But that actionable data is going to start the ball rolling. So if we react in a timely manner with that clinical expertise, so from afar, we can actually use evidence-based clinical interventions, use established protocols, and clinically accepted education that's going to engage the patient. You now know what's going on with the patient, and then that telehealth nurse can coordinate that care either by sending out a nurse, for example, communicating with a physician. So now if we think about it, we've got this information, we're acting upon it, and we are doing something about it in a very timely manner. That in and of itself is going to assist us with our outcomes, which will in turn help us operate more efficiently under value-based purchasing. But our outcomes measurements that we are currently judged on, home health agencies are currently judged on for example, their star ratings and their HCAHPS, and all these are going to be folded into that value-based purchasing. So let's talk about how telehealth can actually impact those relational measurements. And oftentimes, these are measurements that people don't think about when they're establishing a telehealth program, but they're easily included in that telehealth program. So think of shoring up your foundation. So don't just focus on your readmissions, your ER visits, and your hospitalization days, but focus on those other things which contribute to the issues that would cause a readmission. So for example, on ambulation and getting in and out of bed, there are questions that you can structure. that would tell us what's going on with that patient and maybe why that is the situation that we see in the home. There's also shortness of breath and pain. Both of those can be addressed by telehealth nurses by the appropriate questions, particularly maybe some medication issues, and communicating with the caregiver, the home health nurse, and potentially a physician. One of the key issues that is relational and supports the outcomes is medication education. Think of all the problems that are dealt with, or all the problems that come about because of a misunderstanding of your medication. And this gives that telehealth nurse the opportunity to continue to educate and communicate that back to the home health nurse. And then there's also that judgment of management of oral meds. We can go even further and talk about fall risk. That can tie right into that management of their medications. So all this pulls together, and it's information that you'll have at your fingertips, and it's going to prompt care coordination, and it's going to prompt other actions which will move you to improving your scores. So it's the relationship with that telehealth staff. So it's very important that all these things impact all the scores together. So we don't look at just a very tunnel vision for just readmissions and ER visits, because we're going to be judged on so many other things with value-based purchasing. All right, I think, do we have another poll now, Scott, or are we there yet?
Nope, time for a poll.
Okay, that's what I thought. All right. So as we talk about these things, I can see people are flipping these things through here pretty quickly, but let's just talk about the goals that we want to look at, and that's going to, I'll try to direct my additional comments addressing where people have checked that they are really want to focus their telehealth program. And quite frankly, what I see coming in, Scott, is that it's really just a little bit of everything. And one thing that appears to be particularly high is wanting to increase referrals due to superior quality.
Yeah, it looks like that's the hot button for everybody right now, that everybody responding so far has selected that as one of their major goals. And, you know, kind of a little bit surprising to me, because I thought people coming on this webinar all about value-based purchasing would be focused on how do I reduce hospitalizations in those first 60 days, ER visits. But by doing those things, you also help increase your referrals, because your outcomes and quality are so demonstrably better that they kind of go hand in hand, I guess, wouldn't you think?
Yes, they do, and actually I'm pleased to see that so many people want to increase the referrals due to the superior quality and outcome. Those first three really support that. But let me just mention something about that too. What we're seeing is that home health agencies are already, or starting to at least, look at telehealth because their biggest referral sources are already impacted by value-based purchasing, or they are at risk in one manner or another. So a physician or a hospital refers to a home health agency, but physicians are already being impacted by value-based purchasing. So their goal is to get the best outcome. And so obviously, now with Medicare, everyone has a choice. We all understand that. But if you're the agency that does the best in regard to quality, then people, not only the patients, but also the physicians and referral sources are going to want to send their patients to you or have you work with their patients. So I'm glad to see that. And hospitals that are already working with the bundled payment projects, home health agencies have a wonderful opportunity here to be able to participate in more unusual or different ways of providing care than the home health episode, which has been the key to the majority of reimbursement for home health in the past. So I'm excited to see that. We also see a number of them that want to reduce their nursing visits. And the key there is really understanding how to do that. And we're going to talk about that when we talk about integration with the team and the field staff, because that will help us immensely. So that's going to be key. All right, well, that's very exciting to see people have taken that approach to going through so many different reasons for wanting to do this. So let's talk about care team integration. I'm sorry to say, but in many cases, this is where we have seen people or programs fail. And what happens is we have this actionable data, and it's very important, and I want to emphasize that. It's the tool. The remote patient monitoring equipment is a tool, and if when properly used and reacted to timely, then you're going to get the outcomes that you want. So think of, as we start here by actionable data, it's really the thing that sets off a chain of events. It's going, what should we do now? Where should we go from here? Because in many cases, that actionable data is going to take the next step, but in one of these areas, it often breaks down. So let's just move on here and talk about, okay, it's key. Once you get this data, the first responsibility of your triage group is to do something about it. And what we've seen there is that sometimes people will get the information, they'll have it, they'll know what's going on with the patient, but what did they do with it? So once they have the information, maybe they've talked to the patient, but you've got to take it that next step. You've got to communicate with other caregivers if necessary. You've got to know that you're committed to seeing that that intervention is timely. So for example, if you're looking at a group of patients and you don't want to wait till the end of the day to call a physician, depending on what's going on with that patient. You want to make sure that you get that information to the right people, that you get it back, and that there can be a response to that person by the end of the day. That's the important thing. So you've got actionable data, it kind of starts the ball rolling, but now what do you do with it? So you've got first step, your telehealth group, they need to be on top of it and know what they're going to do. The next thing is making sure that they communicate with everyone. We talked a little bit about the other caregivers, depending on what's going on with the patient. So you've got that data, so then move it on, keep that ball rolling. Care coordination. This is often where we see that there becomes an issue because it's handed off, but you've got to make sure that that information comes back to you. The people in the telehealth department or their unit, whatever a agency prefers to call that group, it's really key. If you think they're the hub of the wheel, they know how many doctors that patient is seeing, they know who the key physician is that's managing their care, they know who the family members are, so it's their job to coordinate that care and see that things are worked through completely so that they can get the best results for that patient. So they've got the insight. The other issue is that they have the ability to provide different information to a physician. I don't know, I often tell this story, but my mother had some chronic conditions, and one day we went to the physician, and he said to her, "Miss Thomas, how are you feeling today?" And she goes, "I'm great." And I remember thinking, great, your sugar skyrocketed, you don't feel well. But the point is, physicians don't always get either good information when they talk to the patient, or maybe they get a 30,000-foot view. So when you've got telemedicine or telemonitoring, then you're able to say, here's the trend, here's when they felt bad. You're giving that physician much better data, enabling them to make a more informed decision. So it's very important that we've got that care coordination, we take that information, and we communicate it. And here again is our timely care for the provider. It's always key, and we've talked about that. And if you think of how important it is to get all these people back together, but that's going to get you your best results and communicate to the team. The other key issue I would like to emphasize, particularly with a home health company, is that when you have your staff out in the field, or however you choose to communicate with them, or whoever needs to have this information, the key is when we went back and we talked about setting up the program goals and what did you want to do, everyone involved needs to understand what those goals are. A team functions better as a team. So those people who are physically seeing that patient, it's important that they're out there, they know what the goals are, they know what the timing is, and together everyone within the agency knows that your goal is to keep these people healthy, do the best you can for them, and keep them from going back in the hospital. Okay, so if we're going to summarize, what's our best practice, right? Think about creating goals. Remember, once again, someone talked to me one time. I said, what's your goal? And they said, to set up a telehealth program. I said, well, what are you going to do with it? The key is, what are you going to do with your program? What do you expect out of it? So who do you want to take care of, and why do you want to take care of them, and how do you plan on doing it? So design that program structure. Remember, it is key that if you will take the time, design your program, know who your team is going to be, what equipment you're going to need, and how you're going to pull it all together. You cannot function without the clinical expertise. So it's important that we know, once again, as we think about this, it all ties so neatly together. We know who we want to take care of because they're our vulnerable population. They're the population that if we take care of them, we can move the needle and the right direction, improve the outcomes, provide better so we want to make sure that that team has the clinical expertise to do it. And I might add here too, sometimes we see in this particular area, for example, if we have a population that is, the majority of that group have diabetes and CHF, for example, it's often a good idea to make sure that you might have a specialty nurse or someone who can provide very specific education to take care of those patients, and then how you're going to provide that education, and also how do you judge that program. So are they doing well with their education? Are they coordinating the care? So it's key that you've got the right clinical expertise to take care of that group for you. The other thing is, when we're define your equipment needs, know that in the end you want to provide just what is needed, no less and no more. That will assist you in getting your outcomes, and it's going to assist you in meeting the needs, meeting your dollar amount for expenses, which will generate your ROI. Make sure when you talk to vendors that you know what their customer support is, that you know how progressive they are. Are they looking at new things? Are they finding less expensive ways to develop their software or their equipment? If you think in time, most technology becomes less expensive, and that's, you're looking for a company who's progressive and is going to help you reach your goals. They need to be a part of the team. Okay, here we go. Understanding operational efficiencies and ROI. This goes back to what we talked about prior to this, and that is knowing that home health agencies don't have extra cash laying around, and we want to make sure that whatever we spend our money on is that something that's going to at least break even for us, and in this case, generate better outcomes, which will assist us in being incentivized for the value-based purchasing program. So we want to understand how to set this program up efficiently. How long are people on the telephone? Are they getting the same outcomes as the people who are on the phone less? How much does a phone system cost? What do you want within that phone system, for example? Are you going to record your calls? Are you going to be able to get all the information from the phone system that you need? The same way on your equipment. Are you going to be able to get your reports? Are you going to have all your analytics? Because as we talked about in the very beginning, our goal now will be that we will need to be able to prove that we have these outcomes and that we can do it efficiently. Because past value-based purchasing, there's other opportunities out there in regard to working with companies that are going at risk, whether it's a hospital or maybe an insurance company, and physicians who are working with value-based purchasing. I don't know if anyone on our webinar today has thought about it, but we are actually seeing some physicians who now do not want to spend the total amount for a Medicare episode because they're now working with a bundled payment project. And so they're saying, well, that's really expensive. Can you find a different way of caring for these patients and still getting a good outcome? So it's really becoming a disruptive way of providing care. I think it's great. I think we'll be able to do a lot more. But once again, we need to think how we can use this, because everything is changing, and it's not going to go away, and it's going to be here. It's going to stay with us without a doubt. So now let's talk about what might be our obstacles. Okay, let's recognize those obstacles and see what are the missing components? What do we need to think about? I talked just a little bit about startup costs already, but think about your startup costs. So why